behalf of our co-host, the Robert Wood Johnson Foundation, and our ISF team. Sandy Dempsey, ISF's co-founder and senior advisor, is in the back. The board of directors of ISF, our national advisors, many of whom are with us, several of whom I should say, and our staff, Carolyn Smith-Brown, Marcy Witherspoon. So you will hear from Jane Isaacs-Lowe at the conclusion of this program, but I want to start by thanking her and Kristen Schubert and Susan Promislo and the entire team at the foundation. They have really helped lift this work to a higher level, and their vision and planning has been a part of all of it. I also want to thank our local and national sponsors who have lent their financial support and spiritual support. They're listed in the program. And again, a special thank you to Joe Pyle, who's the president of the Scattergood Foundation and has been integral into making this happen. So this is a very special evening for several reasons. For us tonight, we have the opportunity to hear from 3 national experts in the area of adversity, trauma, and resilience. Tonight is a culmination to what has been an extraordinary 2 days. Over 150 national and local experts gathered in this room to participate in a profoundly important dialogue on childhood adversity, trauma, toxic stress, resilience, and prevention. We are so honored to have many of these experts still with us. We thought they'd go home, but it's been so amazing they stayed. So each one of them is doing groundbreaking, important work in their own communities. And let me show you a little something about where they live, many of our local people, and how we're connected. This is a real map. You can get to it at the ISF website, and you can be added to it as you begin to get interested in being a part of this revolution. In 1854, John Snow, a London physician, stopped a cholera outbreak when he traced its source to a drinking well dug next to an old sewage pit. With that discovery, countless lives have been saved because we now understand how to prevent infectious diseases from spreading. Today, we're on the front end of another health revolution as profound in its reach. It starts with protecting the brains of very young children from toxic stress. It forces us to rethink how we deliver services, healthcare, housing, education, counseling, to our most vulnerable. It has particular urgency in Philadelphia and around the world. Today's revolution began not with drinking water, but with data. In the early 1980s, Dr. Rob Anda, an epidemiologist at the Centers for Disease Control, noticed that people with a history of depression were more likely to be smokers. Soon after that, he met Dr. Vincent Felitti, a Kaiser Permanente researcher who discovered that older adults who were obese often had a history of sexual abuse. Together, Doctors Anda and Felitti began to wonder what other diseases might be traced back to traumatic childhood events. And their landmark Adverse Childhood Experiences study is the foundation for understanding the root causes of some of America's biggest and most costly health and even social epidemics. While the ACEs research was initially met with great skepticism, new insights from the rapidly expanding field of brain science, like child abuse or neglect, can create has turned the tide. I missed the sentence. Insights from the rapidly expanding field of brain science has turned the tide. Neuroscientists have found that traumatic events like child abuse or neglect can create dangerous levels of stress in children, toxic stress, and can have long-term damaging effects on learning, behavior, and health. Because there is more brain development in the first 3 years of a child's life than any other time, very young children are especially vulnerable to this kind of stress. I want to pause briefly to recognize that Dr. Rob Anda is with us, or was with us. Dr. Rob Anda, not here yet. And he made a presentation yesterday, and he's been with us through this summit, and his contribution has been invaluable. Having listened carefully at this summit, I can tell you that we are in the midst of a revolution that is helping create a paradigm shift in how we address, treat, and even prevent ACEs. The momentum is strong, and it's coming from communities all over this country. Yesterday, the Institute for Safe Families released the results of the Philadelphia Urban ACE Study, a population-based telephone survey of close to 1,800 Philadelphia residents. We conducted this survey with our partners at the Philadelphia Health Management Corporation to identify the prevalence of ACEs among Philadelphians and to see how we are impacted in our city. We wondered if people living in an urban setting faced ACEs above and beyond what was measured in the original ACE study. In addition to asking about the 10 ACE questions from Dr. Anda's original work, we also surveyed adults about urban ACE factors, including the visitor center's closing in 10 minutes. And as original work, we surveyed adults about urban ACE factors, including exposure to community violence, discrimination, and food insecurity. So I have some good news and bad news. I'll start with the bad news. Based on these findings, 37% of Philadelphians, that's almost 432,000, that is close to 500,000 Philadelphians, have 4 or more adverse childhood experiences. Some of our results are tragic. 1 in 3 experienced physical abuse at the hands of a parent or caregiver. 1 in 3 grew up in a household with family members who abused alcohol, drugs, or other illicit substances. These are significantly higher rates than what has been reported on other population-based surveys. And adding to this adversity, 1 in 3 reported having experienced discrimination because of their race or ethnicity. And more than 1 in 3, 40%, of Philadelphians saw someone being beaten, shot, or stabbed. This is bad news. Sadly, we're also finding that while ACEs are bad for everyone, those living in poverty may be more substantially and profoundly affected than those not living in poverty. So put another way, health outcomes seem to be particularly grim for Philadelphians who are struggling both with ACEs and with poverty together. We will continue to investigate these relationships, but we hope that our findings will eventually inform intervention development, implementation, and lead to focused efforts to help particularly vulnerable populations. But there's good news after that. Incredibly, most adults in Philadelphia surveyed, 85% reported that they felt that the neighborhoods in which they grew up were safe. More than 3 out of 4 adults, 77%, thought that their neighbors looked out, supported, and trusted each other. And 92% reported that someone made them feel special while growing up. So this is really important news, because we know that relationships and connectedness, and you're going to hear from our speakers, are at the heart of resilience, healing from trauma, and being buffered from the effects of toxic stress. So 90% of Philadelphians surveyed have this experience of being connected. And we don't know if these factors, if growing up feeling safe, if these actually have a direct relation to health outcomes, but it is reason to have hope. And as Mr. Fred Rogers reminds us, in difficult times, look for the helpers, because where there is help, there is hope. As some of you now know, I was running the Boston Marathon 4 weeks ago when tragedy struck. Fortunately, my whole experience of this has been shaped by helping my friend, my running partner, who was in a state of semi-collapse, having just run 25 miles and being dehydrated. And I was in this position to help her. And then there was this generous Red Sox fan who gave us this bright new Red Sox jacket. So it's the help that I was both able to give and to receive that stuck with me. So you're all here because you're helpers. And that is alone a reason for hope. We have a calling to this most remarkable and profoundly rewarding work of helping others. You are central to helping transform childhood trauma, and that's good news. So thank you for being here. Thank you for being with us this evening. And I will finally turn the mic over to Dr. Arthur Evans, who is the Director of the Department of Behavioral Health and Intellectual Disabilities for the City of Philadelphia. He will offer a welcome. Dr. Evans, his extensive bio is in our program, is a notable leader in Philadelphia who is helping change the way that we offer care and is leading efforts to work across multiple systems serving families in order to provide trauma-informed care. Dr. Evans.
Good evening, everyone. I know you're out there. I hear you breathing. Good evening, everyone. Okay, good. How are you? Good. For those of you who are not from Philadelphia, welcome to the city of brotherly love and sisterly affection. I didn't know that until I came to Philadelphia, so sisterly affection. And I got to say, that was the most inspiring map I have ever seen in my life. I think it was the music that I really felt like I wanted to run out and save the world or something. So thank you for that map. Thank you all and welcome, and thank you for being here. I am the Commissioner for the Philadelphia Department of Behavioral Health and Intellectual Disability Services, and in that role, I get to oversee the city's behavioral health system. And one of the things that has been exciting about being here in Philadelphia, am I competing with him again? Yeah. Okay, all right. Is that this is a very, very innovative city. And I'm so glad that I have had the privilege of leading the department, because one of the things that we've learned, and I believe is a game changer in our field, is our understanding of traumatic stress, the impact that it has. I'm a psychologist trained in the 80s, but I don't think our training has changed that much, that most people who are trained as behavioral health professionals don't get the understanding of trauma and traumatic stress and adverse childhood events that can really change the trajectory of people's lives. And I think that the city coming together around those issues has been quite, I think, remarkable. We sit in the shadow of Independence Hall, and another thing about Philadelphia is it is a city of firsts, and one of the things that we have decided that we wanted to be here in Philadelphia is the first city in the country to be a really trauma-informed city, and we're working at that effort. And I'll just give you a few examples of that. One of the things that we're doing is to really focus in on empirically supported treatments for people who have experienced traumatic events. And so we've been incorporating prolonged exposure, TFCBT, DBT, and Sandy Bloom is here, Sanctuary. One of the things we're really excited about is that our clinicians are not only getting trauma-specific treatments, training in trauma-specific treatments, but organizations are being trained in sanctuaries. So we're really trying to create this nice trauma-informed way of doing business within our system. I mentioned that we are trying to become a trauma-informed city, which goes beyond just being a trauma-informed system, which I think is really important because many of the people that we work with cross multiple systems. And so our partners in DHS and in the homeless services and even our police department are much more sensitive to this issue of trauma. When the police commissioner here sends me texts about kids who've been exposed to traumatic events because they now recognize that when they go to a crime scene and kids are in that environment, that those kids have experienced some kind of trauma. That didn't happen 8 years ago. That's a result of the conversations that we're having in the system and his recognition that, that they have to change their business as well. And so that's just one example of sort of the cross-systems way that we're starting to think about trauma and to help our other system partners in doing that. One of the things that I think was a appropriate critique of our field was right after 9/11, when you saw for the first time, at least in my career, the public really understanding the impact that traumatic events can have on people. And you saw systems around the country mobilize mental health professionals to counsel individuals. Well, one of the critiques of us, which I think was fair, was that we have those kinds of events that happen every day on a micro level in our communities. And what is it that you all as a field do? And so it's actually happened as a result of a conversation I had with the mayor right before he ran for office. He was still in city council. He said, what do we do when we have these community shootings? And at the time, we weren't really doing anything except waiting for people to develop PTSD and come into treatment. And what we decided to do as a result of that conversation and other things that were going on in the city is that we now send mental health professionals into the communities after these kinds of events to do psychological first aid, to try to get further upstream and not wait for people to develop stress disorders. But again, it's sort of another way that we're trying to, in the city, be much more informed about how we deal with these issues. I think that the work, the ACEs work, is really important. Now, some people say that I like the ACEs work because it fits with my initials, Arthur C. Evans. But that is not, it really has nothing to do with why I like the ACEs work. The real reason is that I think it's a very elegant way of us understanding how these events happen and the impact that they have. And I think that the work that Martha and ISF have done in terms of looking at the urban issues is really, really both neat, but I think also very important because there are the kinds of stressors here in the urban environment that I think are unique. And certainly in my work here as commissioner, I've seen that. So I want to thank all of you for coming to Philadelphia. If you're not from Philadelphia, we're always honored when we have people who come here and have conversations with us to help us better understand these issues. I think we're becoming smarter because of those kinds of interactions. This year we have actually 4 different national conferences here related to the issue of trauma. So I think that says something about the city in terms of our awareness of this. And I'm, again, very delighted that you're here. I hope that tonight's presentation will help us better serve the people in our community and spend your money because we need the taxes. Thank you.
Okay, now let me introduce Angelo Giardino. His title and all that is in your program. But what I want to say is that just a couple of personal words of thanks and acknowledgement. This is actually a welcome home for Dr. Giardino, who was on ISF's board and when he lived in Philadelphia, and then he left us to go to larger and drier pastures in Texas. But he has stayed on and connected to us as a national advisor. His influence in ISF's overall mission, program, and on this particular summit and evening has been immense. He is a leader of great integrity, a teacher with an enormous heart. He has humor, he has wisdom, and he is a key connector with us in all of those who work in the field. The whole package. Thank you, Ange. I'm so sorry I didn't help you.
Well, good evening. I'm the moderator for this session, and my job is to get you out by 8:10 because I believe in work-life balance. So I've spoken to each of the speakers, and I will be flashing time cards to them. But what I really want to do is get them up here. So I'm not going to spend a lot of time with bios because their bios are available on the ISF website, and we really want to hear their content. So our first speaker is going to be Dr. Sandy Bloom, and many of you in the field have been influenced by Dr. Bloom. She is the Associate Professor in Health Management and Policy at Drexel University School of Public Health. She's the co-director for the Center for Nonviolence and Social Justice at Drexel, and she's the founder of the Sanctuary Institute. But most importantly, she's been a mentor to many of us, and she is one of the people who got involved in this field with her inspirational message and the way that she connects the research to what we actually have to do. So it's a delight to have Sandy Bloom giving us a talk tonight. Sandy.
Thank you.